Welcome back to the Mid-Modern Eye Care YouTube channel. Today we're going to discuss one of the three main procedures that we use to treat obstructive dry eye. Previous videos I've discussed a little bit about the different types of dry eye. This type of dry eye is the dry eye that is caused by oil glands being plugged. Again, when our oil glands in our eyelids are plugged, our tears evaporate too quickly, and this is most patients with dry eye have some degree of this type of dry eye. So the three main procedures we do: IPL, so that stands for intense pulsed light. That is a series of laser treatments that decrease the inflammation in the oil glands. The procedure we're going to talk today is what's called the Maskin procedure. That is the procedure that opens up the top of the oil glands, and then we finish it off with a third procedure we call a thermal lid treatment, where we work on getting the old oil out of the oil glands so that the new oil, better oil, can be produced and prevent the dry eye from occurring. So, the Maskin procedure. This is a procedure that I think most patients get a little bit nervous about because we are working on opening the top of the oil gland again. So the oil glands are in our eyelids, and the openings to those oil glands are right behind our eyelashes. And they're very, very small. I do this procedure under 10 times magnification because otherwise the oil glands, they're just too small to see. The procedure starts, first of all, I wash my hands. Then I give the patient an eye drop. This is a numbing eye drop. Typically use proparacaine, tetracaine, pick your favorite cane. It's basically just an anesthetic eye drop to numb the eye up just a little bit. We don't touch the eye in this procedure, but after I give a patient the anesthetic eye drop, then this is a very special formulated ointment that Dr. Maskin, the doctor that pioneered this procedure, that he recommends. After the anesthetic eye drop, I take a little bit of this ointment on a Q-tip. I have the patient close their eyes, and I just gently rub a little bit of this ointment into their eyelashes. And then for about a minute, I have the patient blink a little bit, have them close their eyes, blink a few more times, just to get that ointment spread nicely in your eyelashes and on the very tops of your eyelids. Then, after you're all nice and numb, then I actually do the procedure of opening the oil glands back up. I've brought this. You will not be able to see this. This is not a needle. This is the Maskin probe. On the end of this, there's a very tiny little filament. And that little filament is actually what opens the oil glands back up. You'll notice I can push on this. It doesn't go into my finger or anything like that. It's not a needle. It is just simply a little filament that we use to open your oil glands back up. The procedure, depending on how plugged your oil glands are, keep in mind you have 20 or 25-ish oil glands in each eyelid. So we've got about 100 of these oil glands that we need to work on, and that can take some time. Typically 5 to 10 minutes at least. Some of the oil glands, we may not be able to get them open up. Some patients have already lost some of their oil glands, and of course, trying to open up an oil gland that no longer exists because it's died off from years of not being treated, that obviously doesn't work very well. When the procedure is all done, then we rinse the ointment out of the patient's eyelashes, just because if we leave too much of that ointment in there, it can make your eyes a little bit more scratchy for a few hours. So it's just kind of a nice thing to do. A couple of cautions with this procedure. Even though a patient is numb when you do this, you can still sometimes be aware of almost a popping sound, or you can feel when or hear when an oil gland opens back up if it's a really, really plugged oil gland, and that's completely normal. We see that fairly frequently on patients. Sometimes when I'm doing this procedure, there will be oil glands where I open that oil gland back up and I start to get a bunch of really kind of nasty opaque oil out of that oil gland without doing anything else. Just opening the oil gland back up gets that oil flowing again. And that's when we need the IPL procedure to reduce the inflammation in that oil gland. We also need the thermal lid treatment procedure sometimes to get the rest of that nasty oil out. So those three treatments for obstructive dry eye really, really work well together. If you have any questions for us, don't hesitate to get a hold of us here at the clinic. Also, if you are not one of our patients and you found this video, we hope you've enjoyed it. We encourage everybody to find a competent, good dry eye treatment center in your area for a correct diagnosis. If we can be of assistance, please don't hesitate to reach out or leave a comment below. And remember, you have two eyes, and one of them is not just a backup. Stay safe out there. We'll see you in the next one.